as extreme weather events impact on larger proportions of the population around the world. Lots of us, having been through heat waves or bushfires or smoke exposure or floods or extreme cold weather, might be really wondering, I wonder how much this impacts on the health of the communities around it. So we know quite a lot of information about that from epidemiology, from looking at population studies and then making associations between environmental variables and the health and well-being of communities. And so we certainly have quite a lot of robust information on a population basis around the world. The interesting thing is that we look at so much of this data from a population perspective. We're looking at it, across this several thousands or millions of people across a particular territory. We know that it will have an impact and it has an excess mortality associated with it. When we look at the individual, which is how much of our healthcare system works, we look at an individual and their risk factors, or we look at their particular likelihood of contracting a disease or succumbing to a disease process, we're much less robust in terms of our environmental variables and the way that we apply those. And again, I think this is part of the thinking that we're seeing shift around the world as the extreme weather events take place and we're seeing the environment around us impacting. Extraordinary examples like that would be things like the Black Summer experience we had here in Australia in 2019 and 2020, where the bushfire smoke exposure lasted for many months, from the beginning of spring of 2019 through to the end of summer of 2020. And in Australia, whose population is around 27 million, it's about 12.5 million Australians were exposed to PM2.5 air pollution from bushfire smoke, which is unusual. And so we're learning these population specific. We know that PM2.5 as an air pollutant can be problematic and causes a wide range of health conditions, from cardiovascular disease to respiratory disease to malignancies and cancers. And then on an individual basis, can we reverse that? Can we look at one person in hospital and say, look, your heart attack, your stroke, your infection, your hospital admission, it has the imprint of the environment very strongly. And if it wasn't for the unfolding apocalypse of the bushfire smoke outside in 2020, you would not be in hospital. And so beginning that population, taking the population discussion down to the individual, that's been the dynamic shift, I think, in the last few years. Around the world, we're seeing this increase in extreme weather events. We know that that will impact on the health and well-being of all populations, and there's no part of the world which won't be experiencing changes in patterns of disease, changes in patterns of illness and mortality in response to changes in weather environments. And so for some places, if you're in a more temperate than usual winter, that may in fact improve mortality. We know very cold temperatures are strongly associated with an increase in mortality. But in contrast, very hot temperatures are also associated with a much higher mortality. So by making this shift from the population understanding into what's happening in your health service, what's happening in primary care, what's happening in the preventative space, we really have an opportunity to work with communities in that climate change adaptation space of decreasing morbidity and mortality associated with the rise in increasing extreme weather events, the increase in severity and frequency of these sorts of events. Look, I think it's across the board, and I often wonder if when we're talking about climate change and the need to act on climate change, I often wonder, is there a stronger driver than caring for people in place? And for me, it certainly informs the way that I approach the science and my understanding of climate change. That climate change, it's not a theoretical problem that will occur outside the insulated box in which I find myself, but as the climate changes, it has a profound impact on human health and well-being, from the individual to the community and to the global population more broadly. So I think it's one of the strongest reasons to act on climate change is because of the health impacts of the changing climate. And so who should take the health information seriously? I think it's across all areas of government. It can be from Treasury through transportation, through public policy, through education. But in the healthcare sector, making these links between environmental variables and the health outcomes of our populations has such a lot going for it. It really gives us an opportunity. Most of us practice medicine or work in healthcare because we're trying to improve the quality of life and life expectancy for the people that we care for. And so understanding that the environment is such an important layer of health and well-being on an individual and a community basis, I think is powerful in informing the opportunities that we have to care for people and protect their health. When I compare the understanding of environmental variables or the literacy in the healthcare sector around climate change and its health impacts, just in the last 5 years, the change in understanding and the awareness and engagement, I think, has been shifting quite quickly. Is it fast enough? Is anything fast enough? Have we changed global greenhouse gas pollution? We really haven't in the last 5 years. Are we doing enough fast enough? We're probably not. We are almost certainly locked into a significant shift in global climate. And so should that be informing a faster understanding that people and place are deeply connected, and the way in which we care for the planet will hugely impact on our health and well-being? I think we can still do more. So I've been really impressed, particularly, I guess, in medicine, but certainly across the healthcare sector more broadly. It tends to be a slowly responsive system at times, but we probably learned through the coronavirus pandemic and also through the sorts of extreme weather events that have taken place in Europe, in North America, around the world, through Asia, and here obviously in Australia. We're learning to make those associations, and we're seeing in our communities the benefits of doing so and the risks if we don't appreciate that relationship between people and place. I would put this across the board in the healthcare sector, and I'm speaking dominantly as a cardiologist and physician who works looking after people. And I've talked about a paradigm shift within healthcare of moving from the biopsychosocial model, where we understand the biology of disease drives so much of what we deal with, that the social determinants of health, the social environment in which we find ourselves, is a really important modulating factor and causative issue sometimes for disease. But then broader appreciation that the environment is a key and essential component. And for me, I take it back to fairly rudimentary basics for human condition. We need air to breathe, we need food to eat, and we need water with which we survive. These three environmental variables provided for us by the planet are totally essential to human health and well-being. And without access to good quality products across air, food, and water, our health and well-being will not be maintained. So really making that strong link between people and the environment in which we find ourselves, I don't think we can do that fast enough. And I do think it's a paradigm shift. And so it's really beginning to appreciate that the biological metrics, the reductive model of medicine that has been dominant through our discussions over many decades, needs to shift into a broader perspective. It's a more complex framework. It's more difficult in terms of the epidemiology and finding the p-value in a particular study. But that richness really adds to the appreciation and the work that we do. And it gives us, I think, a hugely increased capacity to preserve and protect, to maintain health and well-being across our populations and for people in their lives.